Well, hello and welcome to Module 8 for the Shai and Singh U.S. healthcare system about hospitals. We are also going to be talking about nursing leadership within the hospital system. The second part of this module, we are discussing Maxwell's characteristics of strong leadership, the characteristics of relationships and responsibility. How important do you think it is to have great relationships with those that you work with when you are a leader in a hospital? And remember, you're a leader as a nurse, no matter what seat you're leading from. But especially if you are the chief nursing officer, the CNO of a hospital, in charge of the nursing of a hospital, you better believe that the relationships that you have with your staff and your nurses and the interdisciplinary team are going to be so critically important to the success of that hospital. You have a responsibility, as Maxwell says, to make sure that you are fulfilling your role in leadership. Nurses are the top hospital innovators. Many times in medical texts, including Shai and Singh, nurses sometimes are not highlighted in the way that they should be. But please know that you can spend hours researching all of the innovations that nurses are the ones that have brought leading hospitals' innovations. So getting back to the text of Shai and Singh, Chapter 8 on hospitals. The difference in hospitals between an inpatient stay or outside of hospitals or outpatient is if a patient stays overnight. So we say inpatient if they stay overnight, outpatient if they're not staying overnight. A hospital is defined as an institution with at least 6 beds that delivers diagnostic and therapeutic services for different medical conditions. A hospital must be licensed, hopefully they are, have an organized physician and nursing staff, have a governing body that's responsible for hospital conduct. They need to have a CEO with responsibilities for operations. Now, many hospitals, hopefully most or all, have a chief nursing officer. But again, this was not highlighted in your Shai and Singh text, so I'm making sure to highlight it here for you. The hospital must also maintain medical records on every patient, have pharmacy available, and provide food services. The construction and operation of a hospital are governed by many different areas: federal laws, state health department regulations, city ordinances, the Joint Commission or JCAHO, fire codes, and sanitation. So the expansion and downsizing of the hospital in the United States, we need to remember that the creation of Medicare and Medicaid, which happened in 1965, fueled the demand for hospital services. Also, managed care emphasized early discharge and outpatient services because that was a way to manage the finances, to not lose so much money. I know that my mother had always shared with me that when she delivered me in the hospital, she stayed for a week. And it was kind of surprising when I had my first baby that I was home before 24 hours was up. So this is changes that have occurred over the course of generations. But we do know that paid per service managed care had this desired effect of reducing growth of expenditures. The average length of stay, ALOS, if you are a nursing leader in a leadership position, some of these key terms would be important for you to know because these are the measures that you're going to be using. So ALOS is average length of stay, average number of days a patient spends in the hospital. Days of care are the total number of inpatient days incurred by a population over a given period of time. There have been sharp declines in average lengths of stay because of the growth of services like home health and subacute long-term care And importantly, it's good to note that no evidence that quicker discharge from hospitals has harmed any patients. I really like this infographic showing that there's different types of hospitals. And you can read about all the different types of hospitals more in the text, but you'll want to, see that private nonprofit hospitals, there's 48% of those. You'll see federal hospitals are 3%. Non-federal psychiatric hospitals are 10%, state and local government hospitals are 16%, and private hospitals, for-profit, are 20%. So 48% of all U.S. hospitals are what we consider private nonprofit. And they must provide some defined public good, service, education, community, welfare, and they cannot distribute those profits to any individual. So proprietary hospitals are also referred to as investor-owned hospitals. They're owned by individuals, partnerships, or corporations for profit. They're operated for financial benefit. And there have been controversies because of self-referrals. So I'm sure as you are and can imagine that there is many different licensure requirements, certifications, and accreditations for hospitals. So as a nursing leader, you're going to be involved in, if you're in a leadership position, management position, you're going to be involved in all of those overseeing. But even if you are not in one of those leadership, formal positions, every nurse is responsible for maintaining the standards. So licensure is required to operate a hospital, and it emphasizes compliance with building codes, fire safety, climate control, space allocation, sanitation. And this is why you will have to watch all the modules before orienting to or during orientation for your clinicals or as a new nurse. Certification allows hospitals to participate in Medicare and Medicaid, and they have to have compliance with federal conditions of participation. We know accreditation, the Joint Commission, or JCAHO, credits a variety of healthcare facilities. And the CMS, Joint Commission, leapfrog groups, value-based care needs to go beyond assessment of safety and effectiveness. And remember that a hospital is generally responsible to stakeholders, not just patients, but the community, government, insurers, managed care organizations, and accreditation agencies. Internally, hospital governance involves three major sources of power. This is from Shah and Singh. Board of Trustees, which is your governing power and your board of directors. Your CEO, your chief executive officer, which receives authority from the board, and they're responsible for managing the organization and helping the senior executive, and then the medical staff. Interestingly, once again, Shah and Singh has left off nursing staff, so I added that in there because nursing staff is absolutely responsible for the management of a hospital. Couldn't do it without nursing leaders. We know that there are many ethical challenges within a hospital system, and as a leader, you're going to have lots of different questions brought up. Are we doing things ethically? Now, in your program, you've had an entire ethics course, but hopefully you're discussing the ethics throughout every course that you have taken at Marquette, and also the ethics through every clinical, because it's there. So we know that we are guided by the principles of beneficence, which is alleviate suffering, and non-maleficence, which is a moral obligation to not harm patients. So this can be challenging because there are definitely differences of opinion on what these ethical challenges would be, what is considered extraordinary or heroic. So nurses in leadership positions are great people to be able to guide the conversation for person-centered care. Other legal and ethical issues, we know that we have to obtain patients' consent before treatment, and we need to discuss alternatives. Patients participate in decision-making, and we know that we have person-centered care. A lot of times, patients will ask you, as a staff nurse or a nursing leader, what would you do if you were in my situation? And the appropriate response is not to say, well, I had a similar situation with my mom or this. It is to say, well, let's look at your options. Let's see what options you have available. You could, the surgery or a referral for a different opinion. Those are your options. And then you let the patient and the family decide on what is best for them. There's ethics committees at hospitals, and nursing leadership is so important to be involved in making sure that those ethics committees are have nursing representation and the patients are involved in those decision-making processes. I just wanted you to be aware there is the Patient Self-Determination Act of 1990, which does apply to all healthcare facilities that use Medicare and Medicaid, and that law requires healthcare facilities to provide all patients on admission with information on their rights. More, we know that we have to make sure that informed consent is obtained. It's a basic patient right, and they have the right to make an informed decision. Sometimes it's not the decision that we would make. I've had patients, especially like in a clinical situation, say, I don't want to keep taking this medication. I'm ready to go. I'm ready to die. And sometimes it's the medical staff, the nursing staff that doesn't want the patient to quote unquote give up. But it is their decision, so we need to make sure that the patient is in right mind, and whether it's end of life or just a different type of therapy or procedure. Advanced directives. So everyone should have their advanced directives be known. It's the patient's wishes regarding their continuation or withdrawal of treatment when they are not able to make those decisions. And public trust. Hospital administrators have a fiduciary responsibility for acting prudently in managing the organization. The hospital should be viewed as a community asset, and financial concerns must not jeopardize the welfare of patients and communities. That is it. Have a great rest of your day. Take care.